the studio with Dr. Dar this morning, and he's going to bring us up to date of things that are happening at the medical center and ways to keep ourselves healthy through this winter season. So welcome, Dr. Dar.
Thank you for having me.
You're welcome. So how are we doing on the flu?
We are very lucky this year so far. As flu is very much controlled.
Wonderful.
We did not have the impact the way we had it last year.
Let's hope not.
Yeah, but we started early.
Yes.
And slowly it was a little bit frustrating so far that we were not able to get rid of it for a long time. Fortunately, for the last 2 weeks, it's very quiet.
Good.
Before that, we mostly had stomach flu.
Stomach flu.
Stomach flu.
Oh dear.
And 1 or 2 cases of influenza.
Mm-hmm.
And it was not like, epidemic suddenly having lots of patients. It was every day 1 or 2, and when we thought that it's over again, some case
Right.
came up. But overall, we did remarkably well so far to contain it, and I'm very happy.
Good. What is the height of that season?
This is the height of the season.
Is it
starting, in the February it will be the height.
Uh-huh.
So we are getting
So
there.
we're in pretty good shape then.
We are in pretty good shape.
Okay.
It doesn't mean that the influenza is not in the community.
Right.
It's not in Green Spring very aggressively, but outside, I heard there are a few cases of influenza in the hospital.
In the hospital.
Yes.
Uh-huh. So our biggest way to protect ourselves is?
The biggest way to protect influenza is we already did it. We vaccinated more than 90%, almost.
Wonderful.
I think, more than 90% of our community.
And maybe those others got it outside.
Yes.
Uh-huh.
And we did this in October.
Right.
So most of community members are pretty safe. There is almost always there is a chance of having a flu even if you have a
Right.
flu vaccination, but the chance is low. And if you get the flu, the intensity of the influenza is low.
Mm-hmm.
So whatever was required, we did it. The main thing. After that is preventing the spread of the influenza. If somebody unfortunately gets influenza, we need to take some measures to prevent it. What we are doing is, in medical center, that if somebody calls us that he has a high-grade fever, runny nose, nasal congestion, body aches, tiredness, fatigue, maybe throwing up, and we asked them if he had a flu vaccine, and they said yes, then we are very comfortable that probably it's not influenza, even if it's influenza, but there is a chance that he has influenza from
Sure.
some type of a rare virus. So we asked them to keep themselves isolated in their apartment till the symptoms are gone and you do not have fever for more than 24 hours.
So then, if you feel sick, stay home.
Stay home. Keep hydrated. Call the medical center and they will advise you what you need to do. Once the virus is active, we have medication that is pretty good against influenza virus called Tamiflu. We can call that prescription, which can be taken. The effect of medication will be that the duration of influenza will be shortened and will be less severe. So prevention, rest, isolation. If you go outside, wash your hand. If you shake your hands with somebody, wash your hand. If you have cough, sneezing, runny nose, wear a mask. And it's very.
Does the pharmacy have those masks?
If the pharmacy has those masks, and if you don't have it and pharmacy is closed, then we can arrange through security to provide you mask. So mask is always available.
Right.
Yes.
Right. And don't feel strange walking around with it.
No.
People
no.
should congratulate you.
People not only should congratulate you, but if you are wearing a mask, they should be very thankful for that. This person is very mindful of the community and is taking, doing the responsible job by covering his face. I will commend that person.
I know sometimes when I pick up a library book that, just from the library, I always make sure I wash my hands later, because who knows who's been handling them.
Yes, and the reason we don't encourage people to come to the medical center if they have flu-like symptoms is because we have a very limited, sitting place.
Sure.
So if somebody comes in, there is always an increased risk of spreading the disease to other person.
Right.
We would love to have you, but this is the special time.
Right. And people come in with compromised immune systems and
Yes. We have very respected senior citizens here.
Right.
Sometimes their immune system is compromised.
Right.
So we do not want to put extra burden on them.
Okay.
So it's always better to take good care.
What else is happening?
Well, 2018 ended. Happy New Year to all of you, all the community, everybody here. We had a very challenging and a very fruitful 2018. 2018, we had some issues. For example, we were not fully, up to date, short of personnel
Yes.
at the front desk, and because of that, there were some, problems handling with whenever we had increased sickness, and the medical center was very busy. And we end up having abruptly one less physician.
Yes.
So all these things were challenging, and then the cardiologist who was coming here, Dr. Muallami, she left, then the neurologist left. So all these were very challenging for us. But fortunately, I'm very happy that we took this challenge and solved all those problems. Now we almost have full staff. Front desk, we have around 7 people. So we are more proactive and more capable of taking care of the patients. And our staff is optimal now. 4 physicians, 1 nurse practitioner, 1 social worker who is expert in psychiatric issues, doing a great job. All of us have seen our schedule is almost completely booked. But what we did, we found out that whatever we do, somebody will walk in, and we have to take care of those patients. So we put specific acute care spots in each physician schedule every day. So at least we have, I think, around 3 spots every day for acute patient, and we can increase it if it's really needed to see one extra patient. So we have been more organized.
Now that's 3 spots for each of the doctors, or just 3 spots all together?
Individual, 1 spot in the morning for 1 doctor, for the other doctor in the afternoon. So this way we distributed it, so that patient, if he comes in the morning or afternoon, there is some spot available for him to be seen. So the cardiologist left, but we have a new cardiologist, Dr. Tariq Shahab, who is coming every other Wednesday. And unfortunately, the neurologist group which was coming here, they stopped coming. So 2019 challenges will be that to get a new neurologist come back to us. And this is one thing we will be working on. We will be trying to get some, psychiatric nurse practitioner or something, social worker. These are the things.
You have a new dentist.
Yes, new dentist.
And a new dermatologist.
Yes, new dermatologist. So, we are doing good.
Yes.
And in spite of all these challenges, I'm very happy that the resident survey, you gave us good recommendations. So we have some deficiency. We will definitely try to cover that next year.
Very good, very good. Okay, we still have a couple of minutes left, so is there anything else?
I can talk a little bit about, dementia. Okay. Dementia is a clinical state in which a affected person can have multiple problems like issues with memories, especially short-term memories, issue with communication, and perceptions, and this is mostly associated with the old age. The statistic shows that from above 70%, 5% population is affected. Above 80 years of age, it jumped up to 24% who can have dementia, and above 90%, around 37% of population.
That doesn't sound very good.
That doesn't sound very good, but I say this is one of the medal of getting senior.
Yes, yes.
But the message I want to convey that this is very common, and nobody has control over it. So if it comes to you suspect that something is going on, don't be frustrated, ashamed, or taken back. Just see that 37% are here who are having the same thing.
Okay, suppose you have some tips for dealing with a person like that.
Well, the main thing is you have to be accommodating.
Just accept them as they are.
As they are. Do not try to correct them. Do not try to teach them. Mm-hmm. The thing you need to do is to teach ourselves and correct ourselves, that even if I correct somebody, for example, somebody comes in with dementia and talks to me, and I talk to them again, answer, and the patient talks the same thing, repeats again and again.
Right.
I don't have to correct him, because if I correct him, after a few seconds he will
he
not
forgets
remember.
He's been corrected, right.
So whatever he says, answer that, be patient. This is something they have no control.
Right.
So I think this is the main tip.
Right.
And avoiding excessive medication is another thing, because most of the medications, some of the medications like antidepressant medications or medications who are antihistamines we give for dizziness and common cold and all those, they can have a sedating effect and can mask and further aggravate the symptoms. And and then there are certain causes of dementia. One cause is Alzheimer's disease, in which there are a special protein in a part of the brain called hippocampus that has a lot to do with memory and linguistics, that affects their behavior. And then there are vascular dementia. Sometimes patients have multiple small strokes that causes vascular deficiencies in the brain that cause dementia. Then there are vitamin B12 deficiencies and Lewy body disease. So lot of medication effects. So lot of symptoms of dementia are not treatable, but if there is some reversible problem, that can be managed.
Right. Okay, thank you. I think you've given us a lot to think about too.
Thank you.
And so glad that the flu season is ready to wane.